Welcome to Backyard OASIS, a podcast designed by and for older adults living in the beautiful Pioneer Valley of Western Massachusetts and produced in the tech studios at Greenfield Community College in Greenfield, Massachusetts.
Hello, I am Gloria Ratcliffe with you again for our third podcast, and we are going to be talking about women's health today. So I would just say that if you have anybody sensitive in the audience or your children are in the car, maybe this would be a good time to change your podcast or only listen to this when you're with yourself or adulting, as we like to say. I would like to introduce my guests right off the bat. We have our returning fabulous guest, Anne Wiley, PhD. And I like to call her Doc Wiley, but I'm not sure she loves that name, so we'll have to revisit that. And then we have Joanne Hayes as well, who is my last guest with her poetry book, and she's also here to talk with us about women's health today. And I'm going to just abruptly hand it right over to Anne, because she's going to give us the facts we need in life. Go ahead, Anne.
So I think in order to introduce this, we want to talk about that women and girls were left out of research about health. Yes. Right from the get-go.
Yes.
It wasn't until the first longitudinal, which means you follow the same population over a period of time, in 1948, in Framingham, Mass., the Framingham Heart Study was set up. And the purpose of that was to sort of figure out, well, what causes strokes and heart attacks, and how can we prevent them, and how can we heal from them? There were 5,000 in the initial study, and about a third of them were women.
Okay.
So they didn't exclude women, but the emphasis was on men and heart disease, particularly in adulthood. And that study was picked up by Boston University and is still going on in a different realm, if you will. But that was in 1971 that Boston University. So longitudinal research needs government money and private money, and it still needs that. And that is one of the things that is changing and is enormously serious for all of us going forward. The second big piece of research was the nurses' study, and that was begun, the nurses' health study, so they already had a population they could easily access, and nurses were interested not only in their own health, but also in going forward for their patients. Now, obviously, that was mostly women who were in the study. So 1948, the first study in Framingham, longitudinal. This is nurse study. There was a 1, 2, and a 3. And so it wasn't until 1976 that the first nurses' health study came. And they studied thousands of nurses from all across the United States. Harvard and Brigham and Women in Boston were the background for those. Again, you see the relationship and connection not only with the participants in the study, but who's doing the research.
And also what they're looking at. I mean, it's not hard for me to understand now if they didn't even start looking at why women die from heart attacks or how they die from heart attacks in 1976, why my grandmother died from heart disease. Like,
correct.
My grandmother had no idea that she wasn't going to grab her arm and fall over like a dude, because she didn't, and she didn't. And she had a multitude of heart attacks over and over, and she looked like she had the flu.
Correct.
And that's how women have heart attacks. They
Correct.
pale, they sweat. It's a different game for us, guys.
Yep.
Continue, Ann.
The second health study, nurses' health study, they kept recruiting. So they're layering on more and more nurses. And, of course, the first study, the people in 1976 are getting older and older. And now it's into the third study where they're actually recruiting. They currently have 250,000. So
Great.
it's the size of the study over time, and that we have researchers in medical facilities following these individuals. It's one thing to take a cross-section.
Right, like a snapshot, like an X-ray is a snapshot, yeah.
So now you got all 55-year-olds, but you don't really know what they're like at 65
70,
and
80,
75.
if they
Correct.
make it, 85, whatever.
Correct.
Yeah.
So, and the third study that was begun in 1956 was done by the University of Minnesota, and they began also looking at heart disease, and it wasn't again until about 1978. So you're seeing the time period that goes by. And that's when we began to make the connections between lifestyle, diet, exercise with cholesterol and heart disease and strokes. So you have to have this interconnection of research that's going on, and
sadly,
it has to be over time.
Yeah, and science takes time, which I understand, but how many women died from heart disease in the 2 years? Probably
Right.
a lot,
Right.
I'm guessing. So
Right.
it's like, it's an important study that we need to continue
There
with.
was one other study that looked at how do we heal from heart surgery. And what they discovered was men healed faster if they were in a heterosexual relationship or a marriage because
Shocker.
someone was at home taking care of them. Women took longer to heal.
Yeah, I'm not even surprised.
No.
I'm married, y'all. I'm not surprised by that.
No, and I mean, so we know that that's
Sorry, honey.
really part of the issue. So, the other thing that we know so little about, we're learning more, is really about the 3 times when women, from menstruation to birthing
Yep,
to menopause.
if they birth, but yeah.
Okay, if they birth, correct.
Because that's
But
a huge
it's-
part of our population, especially my generation and under
That
now.
don't
Although
have
I don't know if it wasn't always true, and the older generations just didn't talk about infertility the same.
Correct.
Both could be true. I learned that from you, Joanne.
Thank you.
Right, no,
Two
absolutely.
things can be true at once.
That's right.
Women and men did not talk about health issues.
Right. You were in 1950. If my, grandmother was infertile, she wasn't going to the doctor and telling them about it. And I don't think she was, but you get my point.
Yeah, right. So, fertility is part of the focus.
It is a focus because even
and that is
it's a
where
huge part of
women
our
have
lives.
had some research done. Again, it wasn't until women entered the field of obstetrics and gynecology, became
Yeah.
doctors,
Yeah.
that we had more interest in research. I mean, the other piece of research that troubles me today is that women's surgery, we pay surgeons less that are doing surgery on women
Yeah.
than we pay doing surgery on men.
I think
so
my gynecologist
hospitals
is gonna be
then
very
are not
angry.
interested
No idea.
necessarily in doing surgery on women because they're losing, not just the surgeon, but they're losing. It's not profitable enough.
So that's like, even if you have a great clinic like we do in our area, the Pioneer Women's Health, I like them. I go to them. I've gone to them. They diagnose my cancer. They save my life, blah, blah, blah. And I'm saying, even if you have a place like that, then they're giving my surgeon a hard time about scheduling her surgeries over at the hospital with me because it's like, hey, there's no money in her, which is probably true.
And that's part of the issue.
Yeah.
Corporations taking over hospitals.
As if her college cost any less than a man's college
And the
to be a
clinics.
surgeon. You know what I mean?
And the pharmacies.
It's just not good. We need
You
to
wanna
work
add
on that.
anything, Joanne?
Well, I was just going to say that I was grateful. I have 2 friends my age who were diagnosed both in the Boston area, one at Brigham and Women's and one at Tufts, with, or Harvard Medical, I guess, with heart disease. And both were able to live 20 more years and got excellent care, but it was because the focus was on what you were saying, Gloria, the different symptoms which were never caught
Right.
of how women respond to having strokes or heart attacks. It's very different.
And that's
So-
also, even a third part that I sort of didn't, it's like sometimes as women, we tend to push it on the back burner. So like I might have a stomach ache, I'm hot, I'm sweaty. Am I rushing to the ER? Maybe not, but maybe I should. We need to be aware of that as women too. But it sounds like your friends were proactive in that way,
Yes, they were.
which is
So,
good.
And one of my sisters had a stroke at 52.
Yeah.
And so, she, because it wasn't all that was about, let's see, it was 13, 14 years ago. So, but she too had access to good health care, experimental health care. That's another thing. We leave women out of any kind of experimental,
Especially poor women.
especially poor
They're
women, but even
banned from
middle class women. don't necessarily. You know, my sister had an enormous
This is
amount
an
of privilege
institutional thing.
as
If
a
you're
judge.
poor, you cannot participate in clinical trials because your insurance is provided by the
Correct.
government. So that's a real,
Correct.
you're not allowed to. I don't know
Correct.
about middle class, so you can speak to that.
So she got to go to New York City, Columbia, and have some experimental interventions done, so that now at 65, you know, she has to be cautious because obviously,
Yeah.
having had that at 52, you know.
And it's shocking just what they consider experimental and not. Like, for example, I had ovarian cancer when I was 31, and I was sent to out here where we live. There's Bay State, Springfield. It's a bigger hospital. And I had what was called the Da Vinci machine. So my doctor had access to this machine. It's basically a computer that has 6 surgical arms with, like, you know, lasers and stuff. I think of Edward Scissorhand. I'm like doing the look, you know, because it's like, I just remember that. And but the good side about that surgery was that I didn't have to have a chemo and a radiation, you know, and I was so young that I was worried about that all, you know. And but luckily it worked and everything. So I was very lucky. But you know, I have access to excellent care, like you said, and I had access to an excellent physician and a great hospital. And I think that makes and I have health care, which is all those things matter dramatically for a person's ability to push forward in this world. A woman's person, I would definitely argue, but any person needs health care in my mind. But yeah.
So if we want to go back to looking at the 3 areas that impact women over their lifetime in terms of all related to reproduction, we can begin to look at the disparity and inequities that exist between white women, even white poorer women,
Yeah.
and African American women in particular. So
Definitely.
I first learned about this when both Beyonce and Serena had enormously difficult birthing experiences. Again, almost dying giving birth.
Wow, really? Mm-hmm. My goodness.
Uh-huh.
And yeah, they have children now. I'm
Yeah,
like, modern era? I'm like, yeah, they're modern people. Yeah, good
Yeah.
point. Okay.
Right,
Sorry.
right.
Sometimes
So-
I think I'm in a time warp and we're in 1902 with women's health, but go ahead.
So their not only was their health compromised,
They're babies, right?
their baby's health was compromised. So the rates of
yeah.
African American maternal death and infant mortality are still way higher than white women and white newborn
Yeah, my
infants.
understanding it's actually higher than it's ever been.
It
And it's
is.
like, normally we say that 3 times as likely to affect you if you're black or brown, but it's like really probably more than that. Someone needs to redo the math because it's like there's a whole population of women that are not getting their access, like you're saying, and that's a huge factor.
And part of it is the prenatal care. Part of it is the care they even get as 13, 15, and 18-year-olds, you know, in terms of their first periods and then going through into their early 20s when they might end up getting pregnant. But there was an excellent documentary called Aftershock, and it's shown on Hulu. So
Okay.
if people have not seen that, I highly recommend it because it does kind of trail and track. And it was put out about 3 years ago, I believe. So it would be worth taking a look at. And you get the impact on the fathers, you get the impact on the grandmothers, you get how the whole family is influenced. So if
Well, they used to call it family planning. Remember? Because we were planning families
That's
together. But not so much anymore, I guess. Anyway, whatever. Go
So
ahead.
I mean, it really is a problem, and so we need to examine. More research needs to be done. My concern again is that the National Institute of Health and other organizations that are arms of the government. The reductions most recently in the last 2 to 5 years, they've been losing funding for doing the research, and stopping research in the middle of the research.
That's
So-
awful. I just so hard to deal with that. Also, I mean, it's not just like you're saying. It's one, black women are dying when they're pregnant. They're dying while they're trying to give birth. And it turns out their babies could be dying in a higher rate of infant mortality before the first year. So, like, up to a year, that's a life you're living there, I don't know how else to put that. So, I mean, we must pay attention to this. It's a staggering amount of numbers.
I'm just wondering if hospitals, for my mother's senior care in Arizona, there was a team. And she was a senior citizen,
Right.
and they didn't have to pay any attention to her. But there was a team of resource people who cared about her food, her exercise. She met with each of them. And if we're doing it at the end of life, and Arizona is pretty keen on that.
Yeah.
Why are we not doing that? And I noticed just being in rehab with a knee replacement that nutrition for the heart attack victims in my recovery place was terrible. Heart attack victim getting poor grade hamburger meat after heart surgery.
Yeah.
This is, this is women's lives. We need to.
And even when Ann said, the family member had a stroke, my cousin also had a stroke, and she's under 50 years old, which scared me quite a bit. But the scariest part of that whole thing, she was intubated, she's in the hospital, the whole thing, life support, the whole thing. She wakes up miraculously and thankfully. But she smokes cigarettes from back in the day. I've always been on her to quit, but she has a hard time quitting. And she was in the hospital for 10 days on a tube, and they didn't even offer her any cigarette cessation for when she left the hospital for having a stroke. I'm like, hello, I'm not a doctor, but I like to play one on TV, folks, and I'm pretty sure that's called bad medicine. She was already quit, you know what I mean? Having been in the hospital, the hardest part's getting past the 4 days, in case you don't know, which some of you do, smoking's a real thing. You got to get off it.
Well, one of the things I've noticed, at least in Vermont and Massachusetts, is that nursing groups are getting together and providing. They're going away from the hospital. They're forming their own units to help people with whatever, nutrition, childcare, elder care. So maybe this is something we have to do. Go outside of the norm. The AMA has never been a friend to women. It didn't start as a friend to women. And so why not have the nurses, male, female, to take up, form their own corporations, if you will.
And that in particular exists in birthing and prenatal care across the country when obstetrics and gynecology were a men's domain. They did not engage and participate and didn't even necessarily listen to their own head nurses who knew some of these issues from their own experience or from women that they knew. So that even back in 1976 in the United States, there were 2 states, Washington State and Vermont, that allowed nurse practitioners to set up their own practice.
Yeah. Well, I was going to say that's actually a problem for some people, myself included, because my insurance company, which again, I'm very grateful to be insured, they dictate to me that I can no longer see nurse practitioners when I find their care is always better because they come from a nursing standpoint. So for women, it's like the things you guys are discussing are care related. Like, how do I not have a heart attack ahead of time, so to speak, right? So it's like that's where you need somebody to come in and help you. But like some of these insurances, and again, it's about access, insurance, who's providing the access. All this is creating such a river, or like an ocean of indifference to who gets what and who. I have luckily I have excellent care. Whereas if I lived somewhere else, frankly, I wouldn't, and I don't want to keep dancing around that because I think that. If you live in a different state right now, or if you live somewhere else where they just have cut your health care, they don't care, and you're a woman, what are you supposed to do right now if you're already pregnant? What if you're 7 months pregnant? I've never been 7 months pregnant. I have no idea. But if you're 7 months pregnant and you live in Florida, I guess you better hope people around you work really hard. I don't know, because it's you're not getting health care and not to pick on Florida. I'm not saying Florida's the only place where you can't get health care, but go to the people telling me I should buy a house in Texas. Okay, I love Texas, but I can't get health care in Texas. I can't get a lot of the things that I have here. And it's I need the things I have here, including the most important thing is health care. It just is such a pivotal part of changing a woman's future and background. If you're pigeonholed down by your reproductive system, let alone your health in general, it's very hard to move forward. It's just very hard. So, like, I think in a way some people do know that, and they would love to see women fall behind. But we're talking about women dying from trying to give birth. That is, like, so, again, draconian, no offense, that I can't even conceptually deal with it. I mean, I was alive most of the time when we had Roe v. Wade. Only recent years did they take that away from us. And now, have I ever needed it? Not necessarily, but I've been where there's been access, and I like access. I don't think we should have to tell a 12-year-old girl that she should have her uncle's baby. Like, I don't. I disagree. And it's like, I'm sorry if you disagree with me. We can disagree. That's our country. But at the end of the day, it's like, you guys don't really realize what you're doing to that 12-year-old girl.
So, again, I have a personal story.
Go ahead.
And I think it's also important to talk about two resources that are available now that people can take a look at. The first is, I came of era when Roe v. Wade was passed. But it was passed in New York State prior to being passed by the United States. So I had a good friend who had moved to Southern Illinois, and she had 3 children, and the birth control failed, and she was pregnant. And they decided together not to have the 4th child, but where are they going to go? They couldn't get access to health care and abortion in Illinois at that time, so that she was able to fly, because she had resources, from Illinois to Syracuse, New York, where I picked her up in my college old Studebaker and took her immediately to Planned Parenthood, because New York State had just passed a Roe v. Wade type legislation. So people were flying in, driving into New York State. Her recovery, you'll get a charge out of this, was in my Catholic single dorm room where she slept for, like 24 hours.
Yeah.
Then I took her back to the airport and she went back to Illinois. So, I mean, that's an example of what people were making decisions even after Roe v. Wade passed in 1973, based on their own personal lives, and in discussion with perhaps their partner, but certainly their medical provider and other women who were helping them make the decision. And people were not using abortion as birth control.
I know. We need to just dispel that right here, right now, because it drives me crazy. That is not a thing. Abortion, first of all, is very expensive, so I don't know why you would choose that as an option unless you're really, really rich. And then it's like, secondarily, it takes a toll on the woman's body, full stop. You're not going to line up for that every day. It's a sad thing that a lot of people come to because they usually are socially, economically forced into the choice. And married women, too, it turns out. All types of women. And we don't know, and you don't know. And you just have to be
that's why
graceful about it with people, I think.
That's a good point. I really thought that because we're such a pill-centric society, and we have pills for everything.
Oh, yeah.
And whether it's vitamins or prescription, that with the pill for termination, that it would be more palatable. It was always
frankly.
sort of the myth around the process for abortion.
Right.
Because people didn't know the science.
Right.
And so we need to do better in education, to help people with the science of the body. This should be in schools, again, along with Indigenous studies.
I had health class, actually, when you were talking about your education. I didn't learn about Indigenous people, but I learned about my health.
Well,
so
this is
interesting
good.
Pivot, you know what I mean?
Yeah, this is good. But there are several states that shall remain unnamed that do not allow, because they have certain practices and beliefs that disallow the study of the human body.
Yeah.
And that should not be in the United States. And if we had more awareness, about procedures, et cetera.
Anything, all of it.
Yeah, we're talking about women's health specifically, but this is something that, in education is being cut and it's being transferred into other areas. And we need to get back.
That's what I meant about access. I fear that, yes, I can wait till September to get my mammogram, but like, what about the lady that lives somewhere? I do worry about other women too. And the reality is, I'm not even comfortable waiting till September for my mammogram, but that's how it is here now. So, I mean, I'm doing the best I can to fit in the system, but at the same time, we need our mammograms, so we got to get them.
So one of the resources around at least reproductive health care is Jessica Valenti, and she writes a post every day called Abortion Every Day, and she tracks, since the Dobbs decision 4 years ago, she tracks how many abortions and where they are located in the United States. And she has a book out that's entitled Our Bodies, Their Lives, and the Truths We Use to Win. So she's Jessica Valenti and Vanessa Valenti, her sister, were among the first 30-year-olds blogging a good 25 years ago. They had a feministing blog. And so she's been at this a long time. But if you only look at 1 or 2 or 3 of her Instagram, Jessica Valenti posts, you'll get a sense of what she's documenting and how it differs from state to state in this country now. The other person who's a good resource is Carrie Baker, Professor Carrie Baker at Smith College.
Oh, great.
And she's following and writes for Ms. Magazine, and she is looking at mifepristone and the pill and sort of the use of that and whether it can be mailed across the country from states that have access to it.
Our governor has stockpiled it because she's, I don't know, a forethinker. And then, but can we mail it to you in, I don't know, let's just
Idaho.
say, for example, sure, Idaho, I was going to say Texas, but whatever. I won't say everything's in Texas. Good idea, Ann.
So another piece of research that was done before the Dobbs decision 4 years ago, June 24th, 4 years ago, is called the Turnaway Study. And that documented abortion in many states, but across classes, if you will, social classes. And so my students last spring read one about a college student in her mid-20s trying to make a decision whether or not to have an abortion or to have a child. And so just the decision-making, as you were saying, that nurses and others forming groups and helping women help themselves.
Yes.
Yeah, I don't know how you're not going to someday find out, like either for yourself or a friend. Like I know for me, I had 2 friends in college who both needed and received abortions. And it's very clear to me that one of those people had access and one of them did not. She did not come from a good neighborhood. She did not have 2 parents. She's not white. And her access to abortion was scary to me. And I'm pretty tough, I'd like to think, although not always. And then my other friend, I don't even know. It's like she had like everything you think you would need for a medical procedure to be comfortable. Let's put it that way. And I couldn't believe the difference in like access, frankly. And I didn't want to even like say anything because I was just like happy that they were better. I mean, and I'm not, it doesn't matter like what I felt about it. It wasn't for me. I just wanted to make sure they had access to good health care. And the girl that didn't have great access, I was more concerned in her post-care, to Ann's point, like that she would have significant like bleeding or whatever, you know, like all the things they warn you about. Because, you know, they basically threw her out of a door at me. And I was like catching her and then putting her in the car and bringing her home and taking care of her myself. And I just didn't know. Her symptoms seemed significant, and then there's no one to even ask or call, and it's just very hard. It was a different vibe than, again, my friend who had access and nurses and doctors and caring teams and stuff. It's very different, and I don't know why that is, and I hope it changes because I don't like that. It's like, you know how when we're kids and they tell us, oh, we go to we all have school in America. We all go to school and it's all the same school. And you sort of believe that growing up, even though it's not true, right? But then it's like they say this, you sort of feel that way that, oh, I'm having what other women have. And then you really realize there's this vast difference. And again, like Ann's saying, race plays such a huge role. Like your gender, obviously this whole conversation is about gender. But it's like, We have to be aware of the race piece right now because it's like they're being attacked. Let's just be honest.
So you might be asking, as we're coming to the end, I think.
Sorry, go ahead.
What can I do?
Yes.
And so I think you can think about advocacy, self-advocacy for yourself by working with groups of women that are interested and want you to succeed in your own health care, or never going when you have a serious doctor's appointment or nurse practitioner's appointment or healthcare appointment. Never go by yourself.
Great advice. I tell them all my
when you're
people
in the
that.
hospital, never be there by yourself.
Never.
Always have someone, even in places like Brigham and Women and some of the fine area research and care facilities that we have in Boston. The second thing you have to think about is collective action, working with small groups in your locality, paying attention to your local hospital. Just recently, our local hospital has reduced what they call in-house transfer. So if you get into the emergency room after 6 p.m. and need to be transferred to the X-ray department or another department, those transfer people, those 20 people have been let go.
Oh,
and
great.
so now a nurse has to transfer you to the other
everything
department.
down. Yep.
And so pay attention to what's happening in your own local hospital. Ask questions and act collectively and pay attention. You can use, if you're concerned politically, you can use the 5 Calls app and make a call to your local representative saying women's health care is important to you and local women's health care is important in your own locality.
And that works for you even if your state's already like blue. Just still call your blue senator and be like, yeah, I'm totally for that. Keep voting for it, whatever.
And I was going to say we're fortunate again where we also have male advocates for women's health care, and they're part of the cohort.
Very true.
And we can't forget them. I mean, we have my state has 2 men who are very involved in all health care, but women's health care, and have been. And
I think in our state too, I would argue Representative Jim McGovern cares a lot about women as well.
Yeah. So those cohorts are important.
So when you think your vote doesn't
Definitely.
matter, your vote does matter.
It does, definitely locally. Like you said, look local, go up one notch. If you look out, but if you come small, you're always going to find more of hopefully what you need. If not, you might be living in the wrong spot.
So, we know that there's an effort underway to suppress vote.
Of course.
In November for the midterms, but onward. But the answer to that is voter registration and showing up to vote. So,
of course,
get engaged, talk to your friends. And then the only other thing I guess I would say, another resource is Katie Couric. In part, formerly of MSNBC, but in part because her husband died so early of colon cancer, she became an advocate. She herself has gone on. And
I saw that actually.
When she had her colonoscopy,
she's like, "I'm on
she
TV,
televised
it." Yeah, okay, girl.
but she even most recently in the last month has talked about women's health care and men's health care and the lack of access to health care because of some of the changes that are being made.
She's a great reporter, too, so definitely follow up with her. I know she's on the Instagram.
Yep.
You can find her probably everywhere.
So thank you again, Gloria.
Thank you very much for coming
Gloria.
and discussing. I know this topic can be complicated and hard, and it's like, but I just think it's very important in this time. And it's just also like I think it's important to come together as women and have these talks because, I don't know if we don't have them, maybe somebody else will have them for us, and I don't think we'll be super happy with the outcome, for lack of a better way of expressing myself today. So thank you all for coming. Alex, thank you so much for your awesome editing. And that's it. I hope you all learned something today, and you'll come back again next time.
This concludes today's podcast. We're always looking for new ideas, so feel free to reach out to Judy Raper, Associate Dean of Community Engagement at Greenfield Community College, at 413-775-1819. If you have an idea you'd love to share. Special thanks to the creators of Backyard OASIS, Denise Schwartz, Chad Fuller, Dennis Lee, and Christine Copeland. Have a great day.